Syncro Medical Innovations presents the Syncro-BlueTube, a small bowel feeding tube that makes it quick and easy to place a duodenal jejunal feeding tube at the patient's bedside. The BlueTube eliminates the need for endoscopic, fluoroscopic, or pharmacologic assistance and often only requires a single X-ray to confirm final placement. This short animation explains the concept of Syncro-BlueTube and describes the proper insertion technique. This training is not intended to override an individual's clinical judgment in providing proper care of the patient. The concept is simple. Tiny magnets on the distal tip help guide the feeding tube into position by a handheld external magnet, virtually eliminating the problems traditionally associated with getting a small bowel feeding tube properly placed. When the magnets in the distal tip of the feeding tube are captured by the magnetic field of the external steering magnet, a bright red LED at the proximal end of the tube lights up, letting you know the process is working. Before beginning the procedure, gather all necessary materials, connect one LED to the tube, and gently place the tube tip next to the external magnet to ensure the LED illuminates. To begin the procedure, elevate the head of the bed to approximately 30 degrees, apply lubricant to the distal tip of the tube, and slowly insert the tube as you would normally place an enteral feeding tube. Advance the BlueTube until the 35 centimeter mark is at the patient's nostril. At this point, the tube's distal tip should be mid-esophagus. Using your hospital's specified protocol, test to ensure that the tube has safely passed the trachea and is in the distal esophagus. Once you are comfortable that the tube is properly placed in the distal esophagus, you may advance the tube to the 55 to 60 centimeter mark. The tip of the tube should now be in the stomach. At this point, take an aspirate using the 60 milliliter syringe provided to further confirm placement in the stomach. Fluid retrieval from the stomach will turn the pH beeper bright orange to red. Once confirmed, insufflate the stomach by infusing 180 to 240 milliliters of air, then retract the tube back to the 35 centimeter mark. With the external magnet placed just below the xiphoid process and slightly to the patient's left side, as shown in position 1, slowly advance the tube until the LED illuminates. Slowly start to move the external magnet from position 1 towards position 2. The magnet should be tilted slightly by gently pressing downward on the base of the magnet to slightly lift the tip of the magnet facing the patient's left side. Continue to move the magnet until the LED turns off. Then advance the tube until the LED re-illuminates. This on-again, off-again technique provides good confirmation that the tube is actually tracking with the magnet. With the external magnet now at position 2, continue to advance the tube until resistance is felt. Resistance will normally be felt when the 75 centimeter mark is at the patient's nostril, indicating the distal tip of the tube is likely at or near the pylorus. Using the 60 milliliter syringe provided, infuse 30 to 60 cc's of warm water while simultaneously advancing the magnet and tube toward position 3. If no resistance is felt and the tube continues to easily advance, there is no need to stop and infuse water. As the tube is further advanced, the clinician may feel a pop as the tube shoots through the pyloric sphincter into the duodenum. At this point, the LED may turn off depending on the patient's anatomy, as the tube may drop into a posterior fashion as it passes into the duodenum. Continue to advance the tube, but now move the magnet from position 3 down toward the lower right quadrant toward position 4. If resistance is again felt, infuse an additional 30 to 60 cc's of warm water. The tip of the tube is now likely at the end of the second part of the duodenum. For a deeper placement, continue to advance the tube from the 4th position to the 5th position by moving the magnet from the patient's right lower quadrant toward the patient's lower left quadrant. Secure the tube and check the aspirate to ensure the tube is in the duodenum. The aspirate obtained should be a golden bile color. pH paper tested with aspirate drawn now should turn dark green, confirming that the tube is indeed in the small bowel. If unable to obtain aspirate, infuse water and quickly try again. Place Luer lock cap on the white hub of the stylet. Confirm that the tube is placed in the duodenum with an abdominal X-ray and remove stylet. Thank you. This short animation explains the concept of the Syncro-BlueTube, but should not be considered as absolute training.